Dear students, welcome back. In the previous session we have seen the esophagus. Now we are going to see the another structure called the thoracic duct. The thoracic duct is the largest lymphatic vessel in the body and it extends from the lower part of the abdomen to the lower part of the neck, which is crossing the posterior and superior parts of the mediastinum, and it is about 18 inches of length. So this lymphatic duct is about 18 inches of length. Okay, and it is having beaded appearance because of the presence of many walls in its lumen. So this is having like such kind of beaded appearance because of the number of walls which are present inside the lumen. Okay, so the thoracic duct is the largest lymphatic vessel in the body. It extends from the upper part of the abdomen to the lower part of the neck, which is crossing posterior and superior parts of the mediastinum. It is about 18 inches long. It has a beaded appearance because of its number of walls present in the lumen. Before seeing its course, we should know about one structure that is called as Nakaili. The Nakaili is located in the abdomen. So this is the Nakaili here. So there is green color part. So it is a normal anatomical structure in the lymphatic system, and it is seen as a saccular dilatation. Here you can see this saccular dilatation, sac-like appearance in the lymphatic channels that are located in the retrocrural space. What do you mean by the retrocrural space? So it is the space located to the right and left crura. So you people know that left and right crura of the diaphragm, and which is a direct continuation of the mediastinum. This retrocrural space is the direct continuation of mediastinum. So in that space this cisterna caeli is present. Okay, and it is located at the level of T12 vertebrae, that to lower border of the T12 vertebrae, and which is located right to the aorta. So you can see here, this is the aorta, abdominal aorta. So to the right side of its aorta, the cisterna caeli is present. Okay, now we will see the course of the thoracic duct. So this one here at the L2 level, you will have the cisterna caeli here. Okay, it begins, the thoracic duct begins as a continuation of the upper end of the cisterna caeli. So it is going to be continuation of the upper end of the cisterna caeli, which is located, the cisterna caeli which is located at the T12 vertebra and enters the thorax. So the cisterna caeli, from here the thoracic duct is arising, and this thoracic duct is entering into the thorax through the aortic opening. Here you'll have the aortic opening in the diaphragm. So through the aortic opening of the diaphragm, this thoracic duct enters into the thorax, and then it ascends through the posterior mediastinum, crossing from right, this is the right side, still it is present in the posterior mediastinum, and crossing from the right side to the left side. It is crossing from right side to the left side at the level of 5th thoracic vertebra. You can see here The thoracic duct is crossing from right side to the left side at the level of 5th thoracic vertebra, and then it runs through the superior mediastinum. So afterwards, after it crossing towards the left, it enters into the superior mediastinum along the edge of the esophagus, and it reaches the neck. And in the neck, it arches laterally. So again, it will move towards lateral side at the level of transverse processes of the C7 vertebrae. So here at this level, here it is C7. At this level, it arches laterally, and finally it descends in front of the first part of the left subclavian artery. So afterwards it descends. It is coming down and ends in the angle of junction between the left subclavian and the left interjugular veins. So here in between them, so this is the left internal jugular vein and the left subclavian vein. At that junction, this thoracic duct opens. So in the neck, it arches laterally at the level of C7 vertebra and finally descends in front of the first part of the subclavian vein and ends by opening into the angle of junction between the left subclavian and left interjugular veins. So this is the course of the thoracic duct. Now coming to the relations of this thoracic duct, the relations are at the opening of the aortic opening of the diaphragm, anteriorly, so it may be at this level, aortic opening. So anteriorly it is related to the diaphragm, posteriorly it is related to the vertebral column, to the right side it is related to the azygos vein. So this one is the azygos vein. At the right side it is related to the azygos vein, and to the left side it is related to the aorta. Okay, so these are the relations at the aortic opening. So what are the relations at the level of aortic opening? Anteriorly it is related to the diaphragm, and posteriorly the vertebral column, and the right side this is azygos vein, and the left side aorta. These are the relations at the aortic opening. Now once it enters into the posterior mediastinum, what are the relations in the posterior mediastinum up to this level? So what are the relations of this thoracic duct? So again anteriorly, so it enters through the aortic opening, still at the posterior mediastinum. Some part of the diaphragm is related there, so anteriorly again it is related to the diaphragm. And next, esophagus. So this is the esophagus which is present anteriorly here like this. So esophagus and the vertebral diaphragm and the right pleural recesses, and the right side pleural recesses is located on the anterior aspect. Coming to the posterior aspect, it is related to the vertebral column and also right posterior intercostal arteries. So right posterior intercostal arteries are related in the posterior mediastinum, and the terminal parts of hemiazygos vein and the terminal parts of hemiazygos vein here. So the terminal parts of the hemiazygos vein. To the right side, it is related to the azygos vein. So here you can see the azygos vein very clearly. Yes. So posterior aspect, you can see this terminal parts of this hemiazygos vein, and to the right side it is related to the azygos vein. To the left side it is related to the descending thoracic aorta. Okay. So these are the relations. So in the mediastinum, again we will see the anteriorly it is related to the diaphragm, esophagus and right pleural recesses. Posteriorly it is related to the vertebral column and right posterior intercostal arteries and the terminal parts of the hemiazygos vein. To the right it is related to the azygos vein, to the left it is related to the descending thoracic aorta. So these are the relations in the posterior mediastinum. Now we are going to see the superior mediastinum relations. In this, anteriorly it is related with the arch of aorta. So arch of aorta is like this. So arch of aorta and the origin of the left subclavian artery. So left subclavian artery is related anteriorly. Again posteriorly it is related to the vertebral column. Towards the right side it is related to the esophagus and left side it is related to the pleura of the left lung. So these are the relations in the superior mediastinum. So because of this course of this thoracic duct, if you observe the relations in the esophagus, so the thoracic duct is changing the places, isn't it? So just go and refer the relations of the thoracic duct with that of the esophagus, then you can understand this thing and you can correlate both the structures. Okay, next. So these are the relations in the superior mediastinum. Anteriorly it is related to the arch of aorta and the origin of the left subclavian artery. Posteriorly it is related to the vertebral column. To the right it is related to the esophagus and to the left it is related to the pleura. Okay, and these are the relations at the aortic opening, and posterior mediastinum and superior mediastinum. Now, some of the structure which is also present in the neck. The thoracic duct is also present in the neck. So here also we are going to see the relations in the neck. In the neck, it forms an arch arising above 3 to 4 centimeters above the clavicle. So this thoracic duct which is present towards superiorly, so this part, okay, so it forms an arch arising about 3 to 4 centimeters above the clavicle. So this is the arch like appearance of the thoracic duct. Okay, so this arch has the following relations. Now the arch is having the following relations. So anteriorly this arch is related to the left common carotid artery and left vagus, left interjugular vein. So this is the left interjugular vein. So these are the structures related anteriorly, and posteriorly it is related to the vertebral artery and vein. So posterior aspect, it is related to vertebral artery and vertebral vein. Sympathetic trunk, thyrocervical trunk and its branches, left phrenic nerve, prevertebral fascia covering all the structures, and the first part of the subclavian artery. So the first part of the subclavian artery is related posterior to the thoracic duct in the neck. So these are all the relations in the neck to the arch of thoracic duct. So it is having only anterior and posterior relations. So these are all about the relations of the thoracic duct. Now we are going to see the tributaries of this thoracic duct. So these are all the tributaries of the thoracic duct. So as we seen in general anatomy of this lymphatic drainage, this thoracic duct drains both the halves of the lower part of the body and also drains from the upper half of the head, neck and the thorax. And the remaining part, that is the right part of the head and the neck and the right part of the thorax, this part up to this part, thorax, and the upper extremity, right upper extremity are going to drain into the right lymphatic tract. So maximum amount of the lymph is drained by this thoracic duct. Okay, so the thoracic duct receives lymph from roughly both the halves of the body below the diaphragm and the left half of the above diaphragm. In the thorax, the thoracic duct receives lymph vessels from the posterior mediastinal nodes and from small intercostal nodes. At the root of the neck, the efferent vessels of the nodes in the neck from the left jugular trunk and the left subclavian trunk. These trunks and either in the thoracic duct or in one of the large veins. So these trunks may drain into the thoracic duct, or it may going to drain into one of the large veins. So the left mediastinal trunk drains lymph from the left half of the thorax. Usually it ends into the left brachiocephalic vein, but may end in the thoracic duct. So it may drain into the left brachiocephalic vein, but may finally end into the thoracic duct. So this is the thoracic duct here, and finally all the lymph is going to end up in the thoracic duct only. So these are all the tributaries of this thoracic duct, especially in the thoracic region. So in the thorax, the left mediastinal, so this one, the left bronchomediastinal lymph nodes and lymph trunk, which are going to finally open up into the thoracic duct, or it may usually end into the brachiocephalic vein and finally it end into the thoracic duct. So these are all about the tributaries of the thoracic duct. Okay, so So there are some variations of this thoracic duct can be seen in its course. Is it may break up into number of small vessels just before its termination, or it may divide in the middle of its course into two vessels again which soon unite. Sometimes it may form a plexiform network in the middle of this course of the thoracic duct. Occasionally it divides into its upper part into two branches, that is right and left. The left branch ends in the usual manner and the right opens into the right subclavian vein along with the right lymphatic duct. So these are the variations seen in the thoracic duct. Okay, this is all about the thoracic duct. Thank you.